but Lyme may be part of the issue. So Lyme is a bacteria called Borrelia, and the Borrelia can cause immune and metabolic effects that can then contribute to significant comorbidity with things like developmental disorders, autism spectrum disorders, and pretty much every psychiatric disorder that there is. So if you're dealing with anything like that, you really want to have in the back of your mind, could there be Lyme here? Because if you don't address it, you'll miss it. And if you can address it with something that is not terribly expensive, that's not terribly difficult, and that has other side benefits that are going to be beneficial anyway, then you can cover for things and make sure you get your child well. So Lyme is everywhere, and it has been shown throughout the U.S. And the first stages may be something like, it looks like you have a flu or an illness, and some people don't even notice that. And then it moves on to things like neuropathy, memory problems, difficulty, concentration. And then if not treated, it can move on to encephalopathy, it can move on to anxiety, psychosis, even hallucinations. And the problem is that it's not easy to diagnose. Only 17% of people will call a tick bite, and I have seen that to be absolutely true in my practice. Most patients don't know they ever had a tick bite, and maybe they didn't. Maybe they got it from another vector. And only 36% will recall any rash at all, let alone a bullseye rash. Certainly if you have a bullseye rash, it is pathognomonic for Lyme. It means you have it. If you don't have the bullseye, you can still have Lyme. And 55% of people will have Lyme, even with negative blood tests. So you can't rely on anything to say whether you have it or not. You have to really just treat it clinically. So if you have a psychiatric disorder, a mental health disorder, a neurological disorder, you really want to cover for it. So here's what I use. This is a 4-herb combo, and I want to point out that there's a booth out there called New Beginnings Nutritionals, and there's some fabulous people that work for that company. Terry is here today with her daughter, and they walk people through these protocols because they're hard to do on your own. So if you need help with it, she is a great resource, and she's here. And so when I first started my practice treating Lyme, I come from a very conventional background, and I was hesitant to not use antibiotics because I had this thought that they were going to be stronger, more efficacious, and but the combination scared me because coming from a cardiac background, I knew what could happen when you combine certain antibiotics. It can prolong the QT interval, which can cause a life-threatening arrhythmia. And so I didn't want to do that, but were the herbs going to be strong enough? So I'm going to show you some data with herbs that are compared to drugs, and that is what sold me, is the data. And so this is the actual protocol, and I'm going to put this up again at the end. It's a great slide to take a picture of. You'll see it at the end. So the first herb, remember there's just 4 herbs twice a day. This is how I do it. The first herb is called glucometics, and it's a 2-herb combo, cemento and stevia. And so let's talk first about cemento. Most of you have probably heard of cat's claw. Cat's claw is a very popular herb that is used for Lyme. The problem with cat's claw is that there's 2 basic chemicals that are biologically active within cat's claw, and you have to know what they each do so you pick the right type of cat's claw. So here's a slide showing cemento. This is a chemograph looking at what's actually in this herb. And you'll see the chemicals listed at the bottom. There's a red box. And in the red box, there's 2 chemicals that are called TOAs. So basically, they're tetracyclic alkaloids. And these are 0.00% in this product, meaning there's nothing at all in this product. This is a TOA-free cat's claw. And the reason that's important is that TOAs are immune stimulating. And I actually talked with a physician about a week or 2 ago who was treating a patient that she thought had Lyme, and she used another form of cat's claw that was in a blend. And that patient started having hallucinations. And this was not a patient who started out with PANS. It was triggered, and I said it's most likely the cat's claw because it's immune stimulating. So be careful with things that are not immune modulating. And immune modulating just means it balances everything. You don't have to guess. So it's like using an equalizer from those old school stereos, right? If something's too high, you bring it back to the middle. If it's too low, you bring it back up to the middle. And that's modulating. And that's what we want to do to not get things wrong. And the problem is, when the TOAs are present, they're antagonistic to the POAs, meaning they counter them out. So you don't get the benefits of the POAs. And what are the benefits? They're immune modulators. so cemento has actually been recognized as a medication in Ecuador as an immune modulator, as well as an anti-inflammatory and an antimicrobial, and that is great for viruses and bacteria. It addresses all forms of Lyme. The spirochete, which we know is the active form, it's shaped like a corkscrew and it likes to screw on into your tissues and cause problems. When it feels threatened, it rolls itself up into a ball, and that is a persister type called a round body. And so this will treat both, and also the biofilm. This is a study that was done more than 20 years ago looking at people who had Lyme, and they were given either the antibiotic doxycycline or cemento, and the patients with cemento did better. 100% of them experienced marked clinical improvement, and 85% of them tested negative for Lyme at the end of the study, and that was higher than the doxycycline group. This study came out in 2010, and if you look on the left, you'll see the control bars, and you'll see there's 100% when we started of the active spirochete of Lyme, and also the round bodies. And when they were exposed to doxycycline, you see that big giant bar up there, it's pink. That's doxycycline taking the spirochetes and rolling them into round bodies, which is more persistent. So it's not actually eradicating the spirochete, it's simply shifting it to a dormant form that's actually harder to kill. And it does that because we know antibiotics have, we've heard the term antibiotic resistant, right? This is one way. And then you'll notice where the green arrow is, this is the concentration of cemento that we're using. And you'll note both the spirochete and the round body are improving, which is what we want to do. In addition, because we're using a non-TOA form, you're going to have reduction of NF-kappa beta, IL-6, IL-1 beta, and TNF-alpha. These are immune cytokines that trigger potent inflammation. In fact, the IL-1 beta has been associated with fibromyalgia and pain syndromes. And then TNF-alpha and IL-6 have been associated with damage to the HPA axis, which is the adrenals and the hormone system, right? And also to neurodegeneration. And then there was a drug that used to be on the market called Feldene. It was removed from the market due to toxicity, but it was a really potent anti-inflammatory drug. And cemento was 86% as effective as an anti-inflammatory as this potent drug. So cemento is going to help you modulate your immune response, bring down the inflammation, and treat the microbes all in one product. So for my practice, if we want to be cost effective, this sounds like a great herb. Here's a study that came out last summer showing that cemento, note the title of this clinical trial. It's really important to note in the title it says the pentacyclic chemotype of Uncaria tomatosa. That means this is not all cat's claw. You can't take this data and say cat's claw does this. This is the kind that's not countering the immune modulating effect of the POAs. And when you go to medical programs that are CME, we're not allowed to mention the actual name of the herbs. So you have to look at the titles and note the clues. It should have said, treatment of inflammation with cemento. But when you're not allowed to say that, you have to use this long chemical term and try to differentiate it from other cat's claw. You'll notice that in this study, this was rats that had a model of rheumatoid arthritis, and they were treated either with the drug methotrexate, which is a disease-modifying drug used by rheumatologists to treat rheumatoid arthritis, and they were either given that or cemento. And cemento had an 85% reduction in inflammation versus 90% with the drug. Very similar efficacy with this herb, and it was statistically significant. And then this is a really cool other arm of this study. If you have children with PANS and PANDAS, you know that once you get them out of the main flare, the game is not over, right? You have to be careful of the next inflammagen. It's never the same thing. You could have strep cause the first episode, but then they get candida, or they go through mold, or they have a food issue, and they flare again, and they flare again, and they flare again. What's happening is they're getting exposed to an inflammagen. In bacteria, they release toxins called lipopolysaccharides, that's the inflammagen. In mold, it's mycotoxins. In water-damaged buildings, it can also be endotoxins, and on and on. So in this study, what they did is they exposed rats to an inflammagen, really potent trigger of inflammation. Note what they used was carrageenan. That's in almond milk and other products. You need to look for that ingredient because it's used in the lab to trigger potent inflammation on purpose. So why would you consume that? And prior to giving this potent inflammagen, they pre-treated them with either the cemento or naproxen, a 74% prevention of the inflammatory issue with the cemento versus 97% with naproxen. So obviously we can't use long-term naproxen due to side effects. You wouldn't want to do that, but you could use cemento. And in a rheumatoid arthritis study, it's important to note that this, look at the title again, it says the pentacyclic chemotype. This means we're looking at cemento, we're not looking at other forms of Caspa. And this was in a very mainstream journal, the Journal of Rheumatology. And it was a human double-blind randomized study, very good quality study. And patients were, these are patients with rheumatoid arthritis who were already on treatment with drugs. They were on sulfasalazine or hydroxychloroquine. And when they added the cemento, their symptoms improved. And you get side benefits. You're going to have blood sugar support, neurological support. It's good for memory. It's good for the cardiovascular system. And we combined it in glucometics with stevia. Why? Let's look at some of the properties of stevia. So stevia, believe it or not, actually has established antimicrobial activity. It's known to be antiviral, it's known to be antibacterial, and it also addresses all forms of Lyme. And here's a study looking at brands. Brand actually matters very much for stevia as well. You'll note that in this clinical study, the control bar on the left is Lyme, Borrelia burgdorferi. That's the bacteria that causes Lyme. And then the different brands of stevia are listed there. Stevia A is the Nutrimetics brand, and you'll notice that there was no growth after 3 days of treatment of what's called the stationary phase. And I'm going to tell you what that means because it's harder to kill the stationary phase than any other phase. What that means is when you get infected with a microbe, what's the first thing it wants to do? It wants to take hold in your system, so it's going to reproduce like crazy, right? It's trying to make more, and build up in your body, making you ill. At some point, it reaches a threshold where it has achieved that status, and then it plateaus. That's called the stationary phase because they no longer reproduce. The problem is most antibiotics, including antibiotic herbs, are what's called bacteriostatic. And this is going to be a shocker, but they don't actually kill anything. They are simply blocking reproduction. And that's why, for instance, if you have strep throat, you have to take about 10 days of an antibiotic. Because what you're doing, if you're reducing the reproduction over a certain amount of reproductive cycles to reduce the amount of that bacteria. So it depends on how often something reproduces. Strep reproduces quickly, so 3 cycles is about 10 days. But with Lyme, it reproduces so slow that 3 cycles is many months, and that's why you treat for a long time. Because if you're using these herbs that are working to block reproduction, you have to hit it a month before you get one phase, another month. And so certain antibiotics are bactericidal, and that means they are actually killing. Those are harder on the microbiome. So what we're looking at is what can work on the stationary phase. And stevia A, Nutrimetics stevia, completely eradicated the stationary phase of Lyme. So then this study compared it to drugs. And so on the left, you're looking at control bars. The green is the stationary phase, the harder to treat phase of Lyme. And this is all spirochetes, active Lyme. You'll note that the doxycycline, that is a bacteriostatic antibiotic, so is Zithromax. Both of those, the stationary phase is untouched. Now, cephalosporins and penicillins like amoxicillin are bactericidal, but even so, the cephalosporin was not very effective. It's hard to kill the stationary phase. Dapsone, which is a leprosy drug that's been repurposed to treat Lyme, not very effective, but the 3-drug combo that's being used by a lot of Lyme-literate doctors is effective, which is why we're doing it. The problem is there's still some left. You see that tiny green bump, and that's why they're now doing a quadruple Dapsone protocol with pulsing, because they keep coming back if there's anything left to reproduce. But with stevia A, there's no growth, none at all. And if you look at this picture at the bottom where the red arrow is, you're looking at stationary phase in the bottom 2 rows. Anything green is a living spirochete. And you'll see in the stevia, red is dead. There's nothing at all left to reproduce. So that's why I use stevia in my practice. And here's another study looking at biofilms. This is another form of persister Lyme. On the top left is the control. Everything green is a viable organism within the biofilm. And you'll note the stevia on the bottom right is just red. So it kills all the viable organisms within the biofilm, and it also reduces the biofilm mass. You see it's much smaller. And also you get side benefits for metabolic syndrome. It's helpful with every aspect of that, with the blood sugar, the cholesterol levels, even blood pressure. It It also will lower the same immune cytokines as Cemento, the TNF-alpha, IL-1 beta, IL-6, NF-kappa beta. Okay, that's the first herb. Okay, the next one that I use is NutriBRT. And the reason for this is Lyme doesn't travel alone. Many times you're going to get co-infections with it, and the lab tests are not very good. It's really easy to miss these co-infections and not know that you're dealing with that. Bartonella causes really profound anger, rage, oppositional defiance. If you see that in your child, you really have to think, is there mold or is there Bartonella or is there both? And so this is a treatment I use for Bartonella in my practice, Petunia plus Commanda. Petunia is an herb that is antiviral, antibacterial, and the viruses are listed here that I found in some research studies. It includes SARS-CoV-2, it includes the retroviruses, it includes enteroviruses, which are a major issue underlying chronic Lyme, and some of these other newer viruses, as well as Epstein-Barr. It also has immune modulation properties, and some of those include the CD4 and CD8 cells. And this is really important in long COVID. The CD8 cells become exhausted and patients remain ill. So if we can modulate that, we can help them feel better. Chinese skullcap does that as well. Petunia helps support a healthy microbiome as well, and it's been shown to help with the SARS-CoV-2. I'm going a little faster because I'm running out of time. Commanda is partnered with Petunia in the NutriBRT, and it is more broad spectrum. It's antibacterial, antiparasitic, antifungal, antiviral. This is going to mop up everything you're missing. It covers everything. And it was studied head-to-head with Advil, and it was 82% as effective as an anti-inflammatory, and 112% as effective as Celebrex. Okay, so that's one herb I use, the NutriBRT, again to cover for Bartonella, and also very good for mycoplasma and viruses. The last herb that I use for killing is Chinese skullcap, also known as Bacal skullcap or Scutellaria bacalensis. This is not the same as American skullcap, which is the Laterifolia. If you shop on full script, you can't get Chinese skullcap. They only have American. So you will not get the properties I'm talking about. So Chinese skullcap has been around for centuries. It's a Chinese herb. It's a flavonoid. It has been shown to be effective at treating staph, E. coli, H. pylori. It has been shown in studies to reduce all forms of Lyme, including that stationary phase. But remember, if you want complete eradication, use stevia. And it does work synergistically with other treatment for Lyme, including antibiotics. It's been studied with doxycycline as well. For babesia, so this is the one thing we haven't talked about, right? We've treated with the glucometics and the NutriBRT, we can eradicate all the microbes except parasites are not really addressed there well. And this is why I put this study in here. What you're looking at in that chart is from a clinical study that came out in 2021, looking at a harder to treat form of babesia called Uncanny. Microti is easier to treat. And one of the standard treatments with prescriptions is quinine plus clindamycin. And you'll see them at the bottom of this chart. That UM means micromolar, right? And what you're looking at is the lower the number, the more potent the treatment is. And the three things listed right above quinine and clindamycin are the active ingredients of three herbs. Cryptoleptin is the active ingredient of cryptolepsis, artemisinin from Artemisia annua, and bacillin is from Chinese skullcap. All three of them had efficacy equal to or better than the drugs. And what I use in my clinical practice is I'd like to combine two herbs that treat the bug I'm going after, and then only add a third if I need more help. Again, because I'm budget oriented. When I'm covering for patients that don't know have babesia, I just use the one, the Chinese skullcap. And the reason I picked that one is it has the most side benefits. It does so many other amazing things that I'll show you in really fast due to time. Cryptolepsis, I want to mention, kills Lyme, Bartonella, and babesia, but it's really potent, and sometimes it's hard for my patients to tolerate it. So I only use that. I add that on if the protocol I'm showing you today doesn't work. Then I throw that on, it's like throwing the hammer in. But the last thing you want to do is treat someone so aggressively that you cause what's called secondary porphyria, because it takes weeks to months to pull them back out of that major episode and get them back on track. A Herxheimer lasts 3 to 5 days. If you take something and you get knocked down longer than that, you likely are not dealing with a Herxheimer, you're dealing with secondary porphyria. We'll talk about that maybe at another time. So separate slide for the enterovirus, because enterovirus 71 is a paralyzing enterovirus, like polio is an enterovirus. And this is re-emerging in our country, and I believe that this is a major issue. It's been found in T-cell testing of people with Lyme to be underlying it, and it's causing, and I believe in the future will cause more issues. So I went to the literature to see what can I do if this comes to my community. And what I found was I was looking at IC50 values. Remember, the lower they are, the more potent it is. You don't just want someone to say this herb kills this thing. Many herbs kill many things, but are they strong enough to eradicate it? That's the IC50 value. And so the IC50 value for killing enterovirus 71 was less than 5 for Chinese skullcap. Around 10 is effective, and under 5 is crazy strong. In addition, it kills mold. You'll see on here it kills candida, and it kills aspergillus and trichophyton. And it's an anti-inflammatory. So it's going to knock down the same things as cemento and stevia, which is your NF-kappa beta, TNF-alpha, IL-1 beta, IL-6. Remember the MMP9 lecture, and if you had a flex pass, the MMP9 is what's triggering the microglia activation in the amygdala and in the hippocampus, causing the damage. And the MMP9 also is what triggers mast cells to activate. So MMP9 is really important to address. Also, it breaks down collagen to feed Lyme and other things. So as you age and you think your collagen is breaking down, is it really that your collagen is breaking down on its own, or is it because your MMP9s are active due to inflammation? So we want to support MMP9, and Chinese skullcap does that. It also will support the COX-2, which remember, COX-2 inhibitors are cell drugs. They're used for pain. And IL-17 is one of the immune cytokines that's been associated with PANs and pandas and also long COVID. And so it's going to help with that. And it upregulates heat shock protein 70, which can help eradicate microbes. But my main reason for loving this herb is still to come. It's because of what it does in the neurological system. There are numerous potent studies showing its neuroprotective effects. These studies are both done in, they're called in vitro or in vivo, which means either in lab test tubes or even in cells. And in both, you'll see benefit. It protects against neurodegenerative diseases by so many different pathways. It's going to reduce oxidative stress, reducing cytotoxicity, reduce inflammation. And it's going to go on offense and help rebuild. So it's going to stimulate neurogenesis. It's going to promote the expression of neuronal protective factors. And it's also antidepressant, it's anti-anxiety, and it's been shown to improve cognitive performance. So Chinese skullcap is really good for the neurological system. It has been shown to cross the blood-brain barrier, so it's going to get in the brain where we need it. And it's also been shown to improve the blood-brain barrier if it's damaged. But most importantly, you can use it long-term. Just like petunia, it's beneficial for the microbiome. It's not going to hurt you to be on it long-term. In fact, Chinese skullcap helps to improve the small-chain fatty acids, which certain microbes in the GI tract produce small-chain fatty acids like butyrate, you may have heard of. And those are what actually help to maintain the gut barrier integrity so it doesn't break down, and also to regulate the immune response at the level of the gut, which is really potent. It also produces plasmalogens, by the way, if you were at the plasmalogen talk with your flex pass. And it's just very safe. There's so many studies for that. Last herb I want to cover. Okay, so to just summarize, 3 herbs that are antimicrobial, because we're not just treating Lyme. We're treating a complex chronic illness that has many microbes as some of the triggering causes. And if you use those 3 herbs together, you're covering everything. If it's not effective, then maybe there's a parasite that needs a little more boost with cryptolepsis, or maybe there's a virus that needs a little more boost with tacuna, which is really potent antiviral. You can throw those in. Those I like to use short term because I don't know what they do to the microbiome, and I don't know what they do long term as far as are there side effects. These other herbs can be used long term, and I feel really confident about that safety-wise. And then we use Berber panella as our support, because remember, we don't want to trigger massive Herxheimer reactions. That's causing collateral damage. It's not good for you. It's helpful to know that what we're doing is doing something, but we want it to be very mild. And that's the reason I do all of my dosing of the 3 herbs that I just covered that kill. I do what's called drop-by-drop dosing. You start with 1 drop twice a day, and you go up a drop every day to your target dose. If any new or worsening symptoms develop, you do not increase. You hold the line until you're back to your baseline. And that way you never trigger a massive herx. It's just this 10 drops is just more expensive. So we just want to, the goal is not to get to the top dose because now I'm treating and now I made it. The reason we go to the top dose is to make sure there's no pockets of things left that we want to kill. Because if you have a Herxheimer at 5 drops and then you make it through and then you go 6, 7, 8, 9, you're like, okay, I did it, I killed everything at 5 drops. But you might Herx again at 9 and hit another pocket. And that's the only reason we go to that top dose. It's not because that's where you're getting treatment. You're getting treatment wherever you're getting efficacy. Okay, so Berber Pinella is going to support the Herxheimer reaction. Berber is going to make your lymphatic system work better, which is so important for drainage. And then the Pinella is going to support the lymphatic drainage, which is how we drain the neurotoxins out of the brain. You need to be doing both. And so it's a combination product. It also supports the liver, the kidney, and the colon, so you don't have to have so many different products. However, if you have really bad issues, let's say your liver enzymes are elevated, you don't want to rely just on Berber Pinella because silly merit or milk thistle is way more effective. So you would add that to it. So sometimes you do need more. And when I treat Lyme, sometimes patients are so sick, I need 5 or 6 support herbs, not just Berber Pinella. But we start everyone on Berber Pinella, and then we can layer others in if we need to. The other things can be chlorella, glutathione, which you may be on anyway, obviously, for many good reasons. Binders, there's so many other things we may add. So Berber Pinella is my basic support for all treatment protocols. Wherever I'm killing anything chronic, you put 1 dropper full in the cup with however many drops you're using of everything else. And you do that twice a day. Twice a day dosing works for all these herbs because, let's be real, it's hard enough. We want to just be twice a day. We don't need 4 times a day. We don't need it to be difficult. We just want to get it in. Petunia, however, is short-acting, but because it's in combination with everything else, I'm comfortable with that. Right? We don't want to just kill a bug and let off the gas pedal, which if you were only using Petunia, you would be doing because it's short-acting. It's about 6 hours. The other herbs, it's fine. And the other thing that I do with Berber Pinella, especially in kids, is I send them to school with 2 to 3 dropperfuls, maybe even 4, in their water bottle that they take to school. Also, I love Avea. Nutrimetics has an herb called Avea. Helen's nodding her head over there, which is liquid curcumin. And they can put a few dropperfuls of that in the water bottle and take it to school. You don't have to stop at a nursing desk with a water bottle. It's just easy to do. And they don't decompensate due to the lighting, the mold, the 5G, whatever's in that classroom that normally they'll decompensate by the end of the day. It'll help support them throughout the day by drinking it in their water. And then if you have a Herxheimer, you take a lot real quick to pull out of it fast. And so that's how I use Berber Pinella. And this is my dosing if you want to take a picture of how to support yourself. It's so hard to address chronic infections on your own. So if you need support for this, stop by the New Beginnings booth, talk to Terry who's there, Lori is on the phone if you call, and they can help support you through this pathway. They have a webinar that I've done on there. You can watch the same webinar that I'm doing today all over again because I talk fast. You can do that. Actually, she gave me an hour, so I only have 40 minutes here, so there's a lot more in that talk. And for pediatric dosing, I lower the dose of the killing herbs. So I'm going to show you the full protocol. Normally I work up to about 40 drops of each of those 3 killing herbs twice a day for adults. For children 6 to 12, just cut that in half and do 20. For children that are 2 to 6, cut it in half again and do 10 as your maximum dose. And if you're doing Clark's rule, you're basically doing that simplified by doing this. And if you have a child who's a little bit closer to an age or a little heavier or lighter, you know, it's an herb, it's forgiving. You can adjust that target dose a little bit either way. Now, I just want to mention one more thing about stevia before I get waved off the stage. I showed you that it kills all the persister cells. What I have found in my practice, I picked up from the Dapsone protocol, because the Dapsone protocol for Lyme was touted to be a 2-month protocol and to be able to eradicate Lyme. So when I saw the study showing that the Nutrimitic stevia was as good or better, I thought, well, 2 months should work for this too, and it does. When I look at PCR data and symptoms, what I'm finding is that I have to add this for 2 months. And I don't always do it in the beginning. You can use the glucometics. But the glucometics, when you want to add extra stevia right before finishing. So you always treat for 2 to 4 months after symptom resolution to make sure it doesn't just come back again. At that point, add another bit of stevia to your regimen. I would, depending on age, I would add 1 full dropper of stevia to all the other herbs, including the glucometics as some stevia, before you finish off and start pulling the herbs down. And so I hope that's helpful. I hope that your children are blessed through this and through all the endeavors of everything you learn here. there. This is an amazing conference. The exhibitor booths are where you're going to learn how to do a lot more to help your kids. So stop by, talk to everyone. We're here to help.
University in 1985. He holds his medical license in North Carolina. Dr. Rawls has written extensively on health topics, including Lyme disease, fibromyalgia, and chronic immune dysfunction. He's the author of Suffer's Long Enough and Unlocking Lyme, and has contributed to various health sites. Let's hear it for Dr. Rawls.
My career started in obstetrics and gynecology, and I did that for about 20 years, but did call every second or third night, and it really just trashed my health, identified with chronic Lyme disease, just from not having any other choices, did herbal therapy, got my life back, and I've spent the last 15 or 20 years really understanding herbal therapy and understanding what these illnesses like chronic Lyme disease actually are. And it's taken me to a very different place than a lot of other people. So this lecture is as more of an overview, so just sit back, relax. I'm not going to hit you with a whole lot of details. We can talk about all that at different times. But the concepts are really, really important for people to get. And I think that we lose sight of that. When a patient comes into the doctor wants to know how they're sick. What the diagnosis is, what's going on, what and how to treat to get rid of that dysfunction in the body. And I started asking the question, why? Why does this individual get sick? How did they become sick? And it brought me to a very different place. So, let's see if our flicker works here. So if you want to solve a problem of chronic illness of any kind, you really have to get to the root causes. And sometimes we don't define the root causes correctly. So inflammation, I hear about that all the time. Inflammation is the cause of chronic illness. It's not. It's not a cause. It's part of the process of the illness. Something's causing the inflammation. If you're not getting to the root causes, like if you're treating somebody just with an anti-inflammatory drug, you're not getting to the root causes of the inflammation. And maybe that will help them in the short term, but it's not going to make them well. Hormone imbalances are not a root cause of chronic illness. They are part of the process. Something is disrupting the body to cause those hormone imbalances. And similarly, I was listening to some lectures yesterday. Mitochondrial dysfunction is not a root cause of chronic illness. Something is causing that mitochondrial dysfunction. So if you start getting to the root causes of things, then you're better able to truly solve the problem. So even after labs, when we get all these labs, you go to the doctor and they get labs and labs and labs and labs. Most of that is testing for dysfunction, not defining the root causes of that dysfunction. So it's really important to get there. And when we look at illnesses like chronic Lyme disease, I consider the microbes as actual accomplices and not truly the root causes, not the culprits in the problem. And so you'll understand as we go through this lecture what I mean by that. So if you were in my lecture yesterday, there's some overlap in the slides here, but this is getting to some different points that I'd like to convey. So if you were there yesterday, you get a little bit of review. It will be good, I promise. So, getting to the root causes, you have to get down to the cellular level. So our whole body is made of cells. We don't think about it that way. We think about ourselves. When we look in the mirror, we don't see a big mix of cells. But we are totally cells held together by connective tissue. So everything in our body, everything that happens inside of our body is done by cells. Whether that's thyroid hormone being produced, your heart beating, your brain impulses firing, adrenal gland functions, everything that happens, bones and skin being knitted together after an injury, it's all done by cells. So when you look at our cells in our body, everything functions because all of our cells are talking to one another. So every cell in the body is constantly communicating with every other cell in the body, and that is all done by hormones, signaling agents, and nerves. So our brain is monitoring what's going on outside of us and what's going on inside of us, and using nerve pathways and hormone pathways to monitor, to modify cellular functions to meet those demands of what happens to be going on at that time. So when you look at wellness, wellness is when all of our cells are healthy. So if all of the cells are healthy in your body and all of the actions of those cells is being coordinated, you won't have hormone imbalances, you won't have inflammation, you won't have symptoms, you won't have abnormal labs. So really getting to the root causes of what may be affecting our cells is really, really important. So I think it's really important to note that our bodies are very different than mechanical devices. We sometimes get compared to a car, or maybe lately one of Elon Musk's robots. But you have to understand that man-made devices are single units. So one of Elon Musk's robots is a unit, and anything in that unit breaks, that robot isn't going to work until that is fixed. And the same with our cell phone, our car, or anything else. So when we look at this idea of our cells being, we're composite of cells, it means we can lose cells without having to stop things and repair. So our body is constantly losing cells. We lose billions of cells every day. So our heart can keep right on beating even though we're burning out cells and we're losing cells. So when you look at our cells, every one of our cells is an independently functioning unit that does work. So you can think of them as like little microscopic machines. In other words, every cell has a job. So your thyroid cells, their job is producing thyroid hormone. Your heart, making your heart beat, working together in conjunction with other heart cells to make our heart beat. Really important for those things. Okay, here we go. So, they know their jobs, and they know their place in relation to all of the other cells in the body because of the genetic material stored in our genes. So it's like an internal hard drive. And the collective information that's in all of our cells is greater than any supercomputer on Earth. So that information is vast. Inside our chromosomes is the history of all the stress factors that humans have been exposed to. Microbes, everything. So it gives our cells a lot of information. So that genetic material, there's a complete blueprint for every single cell. So our cells can use that blueprint and the information provided by that genetic program to completely rebuild. And they're constantly doing that, using a process of autophagy Cells are constantly pruning out worn parts. So working all day, it's hard work. You wear out parts. They're little microscopic machines, and so they have to repair that. So they use that genetic material to rebuild parts. So nutrients, food, a lot of that is parts, new parts to replace old parts and damaged parts. So as long as that genetic program is intact and the cell is getting the right nutrients and there aren't any other stress factors, then it can just keep rebuilding itself. Now there is a limit to that, and it's energy. So mitochondria supply energy, and when our mitochondrial functions gradually run out, that's when our cells gradually lose the ability to keep functioning. As long as they have energy, they can keep right on functioning, they can keep right on rebuilding. So what we know is the healing process is actually cells recovering from stress or rebuilding from wear and tear. So it's really important to recognize that healing is cellular. So this is the formula for wellness right here. So you can think of all of our cells in our body, they little microscopic machines, and all machines have operating requirements. Every cell in the body has to have certain things to function properly. And if they get those things, then they're going to work great. So they have to have the right nutrients. Now different cells do need different nutrients. It's like those thyroid cells need iodine to make thyroid hormone. Our heart cells burn mainly fat. Our brain cells burn more carbohydrate. But as long as they're getting nutrients from like a whole food diet, they're going to work just fine. They need a clean environment. So whether you're talking about natural toxins like mycotoxins or toxic substances from the environment, from chemical and petroleum industry, coal burning, all of those things get in our body and they basically get stuck inside our cells and inhibit cellular functions. It's like throwing sand or dirt into the machinery of your cell. Your cell keeps right on working, but it has to work harder and it burns out faster and it runs out its energy faster. So a clean environment is really important. Cells need good blood flow. When we talk about exercise, the benefits of exercise just go on and on and on, but top of the list, the most important thing is we move blood. So when we're walking around, we're moving blood, and what that does is it washes, it basically flushes the tight spaces between our cells, carries away debris, congestion, built up metabolic waste, moves that on out, and delivers fresh oxygen, fresh nutrients, so basically it helps our cells breathe. And if we're not doing that, those spaces between our cells get congested. And our big problem in chronic illness is there's a lot of congestion, and people can't move because they don't feel well. So that's where things like sauna can be really important, because the biggest thing sauna does is heat the body up and get blood flowing. The solution to pollution is dilution. So just moving blood, really important to get that going. Cells need downtime. And some cells in the body, like our heart cells, have to rest in between beats. That's why our heart cells are so vulnerable. That's one big reason. But most of our cells need downtime. So when we're sleeping at night, our cells aren't working as hard. And they're recovering. They're recovering from all that work they have to do during the day. Using a process that we call autophagy, they're constantly repairing, and that is really optimized during that time that we're sleeping at night. So if you're getting 6.5 hours of sleep, which is average for Americans, you're starting your next day with a deficit that your cells haven't recovered from the day before. So when I talk to a patient, they walk in and it's like, I have all these symptoms, I feel terrible, what should I do next? Should I hit myself with antibiotics or some other toxic therapy? And I talk to them and it's like, you're only getting 4 hours of sleep at night. first. That's the most important thing that you do before you do really anything else. And then microbes, we're hearing a lot about microbes. That microbe story is interesting, but our arch enemy, the cells, our arch enemy of our cells is microbes. It's a huge factor. So if our cells are getting all these things, we'll be healthy. It's that simple formula. If you're protecting your cells from microbes, giving them the right nutrients, giving them a clean environment, sleeping enough, getting plenty of exercise, you're going to be well. There's just no way around it. And I think we lose sight of those simple things. It's when our cells get stressed, when they get overworked, that we really start having problems. So when you reverse those things, these are the causes of all chronic illness. Every single chronic illness can be traced to these 5 factors. These are the causes, not inflammation. These things cause inflammation. These things cause hormone imbalances. These things overtax our mitochondria. So these are the root causes that you have to really pay attention to as you're helping someone with a chronic illness. Nutritional stress. Think of all the things that we're exposed to. Think of what our kids are exposed to. You know, I've often made the comment that if you go to an average grocery store, you could probably take 75% of the foods on the shelves and throw them out back and burn them, and we'd all be better off. People aren't eating foods that are natural for our cells. Our cells are not designed to get the kind of carbohydrate overload and other substances that are coming in our food supply. We're not built for that. Our genetics are not made for that, right? So for hundreds of thousands of years, we ate a forage food diet, which was predominantly about 2/3 plant matter, but wild plants that was very low carbohydrate, and meat, the lean meat from wild animals. We didn't eat grains and beans. We only started doing that about 10,000 years ago because they require special process. And we've developed some tolerance to those things, but not as much. And we're really missing out on our natural foods. So, when we look at this thing, that eating the right foods is just so important for ourselves. We have mental stress. That is keeping us in a fight or flight. You hold your body in a fight or flight, and you keep your cells on high alert. They can't recover. And you don't get sleep. Toxic stress. All the chemicals. And think about all of our kids. They're at a very vulnerable age. So when you look at cells, we are accumulating. We accumulate cells until around age 20. And at that point, we have 5 to 10 times more cells than we need to function. We don't gain any more cells at that point. So what aging is the gradual loss of cells after age 20. So our kids are building cells like crazy. They're cell-generating machines, but they're very vulnerable to all of these stress factors during that time. And think about the food, the chemicals, and all the other things that our kids are exposed to during this very vulnerable time in life. So when you look at all of these factors thrown together, it can really put someone in a position of being compromised and being very vulnerable to microbes. So when we look at this, we look at, we add in that genetic factor. I don't consider genetics a cause of illness. Genetics defines how we tolerate different kinds of stress factors. I think that's really important to recognize, that it's really a function of how our ancestors, what kind of stress they were exposed to in the past, how well we'll tolerate. And we do pick up mutations along the way that become part of us, but most of those things aren't lethal. They don't necessarily make us sick. So that when we look at this, it's like if some of the worst gene defects out there, the BRCA genes that put women at high risk of ovarian cancer and breast cancer. But so you look at that and it's like you can increase the breast cancer risk and ovarian cancer like 20 to 40%. But I always ask the question, well, what about the other 60% that don't get that? And what that means is, even with a terrible genetic mutation like that, there's still environmental factors that are tipping that balance. So getting back to those stress factors, if you can reduce those stress factors, that's going to put you in a better place in life. When we look at symptoms, symptoms are a reflection of cellular stress. The symptom always points to where the stress is. So if you have chest pain from your heart, you're stressing cells in your heart. Neurological symptoms, you're stressing cells in your brain. Fatigue, you've got stress through cells throughout your body. Basically, your cells have drained their energy from overwork. So that's really important. That gives us a lot of information that we don't pay attention to. I find that symptoms, paying attention, talking to the person, is often much more valuable than any lab that I can get, because the symptom is telling me exactly where and what's wrong with that person. So another thing, when we look at labs, we're looking at dysfunction in the body. So that is all a function of cellular stress. Markers of inflammation, antithyroid antibodies, hormone imbalances, liver enzymes. We're talking about cellular stress there. We're measuring, so these are giving us measures of cellular stress. So someone asked me, well, can you put this all on a curve? And it's directly related. So symptoms are directly related to that cellular stress. And when you look at it on a curve, most of us, we all have some cellular stress going on all the time. But early in life, or if you're feeling great, it means that that cellular stress is such at a low level, you don't really perceive it as a symptom. But as you get more cellular stress, you get more symptoms. And, I think most people live in that yellow to orange zone, that we have symptoms that kind of wax and wane as we go through life, but we don't really do anything about it until it gets significant enough. But even at that point, when we go to the doctor, it's generally well before that we are sick enough to get a formal diagnosis, so we just get symptoms. We get drugs to block the dysfunction, to reduce the symptom, but that doesn't do anything to the cellular stress, so we don't really help it to get better. So it's really way out there that we get a formal diagnosis, and even further out that we actually do irreversible damage. So most of the time, you reduce that cellular stress just doing those simple things. A lot of times you can bring this right back down on the curve and keep yourself healthy. And then there's a micro factor, and I'm going to buzz through this pretty quickly, but looking at microbes a little bit differently. So when we look at microbes, especially the tick-borne microbes, we're exposed to thousands and thousands and thousands of microbes during our lifetime, and it's pretty rare that we have something that comes along that makes us severely, acutely ill. Most of the things we don't even know about. The majority of people who get bitten by a tick don't remember having symptoms. 90% of the people I've talked to with chronic Lyme disease didn't become severely symptomatic at the time of the tick bite. And that's because the strategy of these microbes is not making you severely ill. Their strategy is becoming an ill-fitting part of you. All they want is a presence. So their goal is a well-balanced host-microbe relationship. If they don't make you sick, they can persist in your body, have a presence, have many opportunities to spread to other hosts. And that's their strategy. And if you're well, they're going to do that. So they have really sophisticated things, ways of spreading throughout the body. Once they get to the bloodstream, they can get everywhere. They have really interesting mechanisms. And it's interesting whether you look at Babesia, Bartonella, Borrelia, all the Lyme microbes, Mycoplasma, chlamydia, so many other things, people don't get severely sick when they get that initial infection. The strategy of all of those microbes is persistence, not overwhelming the host. All they want to do is have a presence in your body. And there are two really big mechanisms of how they do that. One is they enter cells. So Borrelia, Bartonella, Babesia can function outside the cell, but the first thing they do when they enter the body is start infecting cells. And it's because these cells give them the ability to be isolated from the immune system and be protected from antibiotics. But our cells aren't necessarily defenseless. Our cells do have mechanisms for getting rid of microbes. That process of autophagy, they can actually eject microbes. But the microbes in our body have been playing this game, this chess game, for thousands, millions of years. So another thing they can do is go dormant. So the two big things that I've found as far as mechanisms of persistence are intracellular, going inside cells, and then slow growth or dormancy. And this has been documented for Borrelia and every single one of the co-infections. So that dormancy just allows the microbe to hang around and wait. They're opportunists. They can wait. And they could wait for a really long time. So I probably picked up the microbes that made me sick, the bacteria, when I was a child. But it wasn't until years and years of taking back all and not sleeping that I became ill. So it's not just Borrelia. This has been documented for all the co-infections. And very interestingly, when I started researching pandas, that was a big one. I thought, could Streptococcus do this same thing? We always thought Streptococcus was extracellular. Turns out they've proven that it can go intracellular, it can stay dormant for weeks or months, wait out the antibiotics, wait out the immune system. As soon as that stopped, pop right back out and do its thing. And it can also travel throughout the body, the brain, everywhere else. It acts just like Borrelia and Bartonella and Babesia. All of these microbes have very, very similar characteristics. So this really, in a nutshell, gives us a pretty good explanation of why pandas and chronic Lyme and all of these illnesses are so difficult to treat. But it's not just them either. I mean, this is a partial list of things that we can pick up that can be lingering, dormant in our tissues. There are just so many things out there. And so the limitation of testing is there are a lot of things that we just don't know about yet. I mean, these are things that nobody tests for this many microbes. So there's just a lot of stuff out there. There's growing evidence that we all pick up things, and that starts in utero. We used to think that kids didn't get their microbiome until after they were born. Turns out that starts being passed. There's evidence that the placenta actually has a microbiome in that process. So if the mother has a dysfunctional microbiome in her body, she's actually passing that to her child. If you're healthy, if you stay healthy, so this state of this reservoir of dormant microbes inside our cells, we all have that to a certain degree. Some may be worse than others, but we all have it. And if your cells are healthy, the cells containing the microbes are healthy, you'll be fine. But if your cells are weakened by constant poor diet, eating the wrong foods, chronic exposure to toxic substances, not sleeping, sitting in front of a computer all day, or just not getting the activity. And think about all the things that our kids are constantly exposed to, or a new infection. So there you have this. So there's evidence that SARS virus that causes COVID isn't just SARS. They found that much of the symptomatology was actually reactivated Epstein-Barr, HHV6, and other viruses and bacteria. So when cells become stressed, the microbes reactivate, they destroy that cell, they invade other cells. So they're emerging from cells in different parts of the body. So different microbes infect different cells and are harbored in different cells. So if you can think about that, the immune system sees all of these microbes emerging from these cells and starts attacking the cells. So I don't think you can explain autoimmunity without thinking about that possibility. So their goal is turning our tissues into a food supply, and basically that's what's happening when we get sick. I like to use the analogy of a pot boiling over, that when we have this going on, so even symptoms like everyday arthritis, it's been found that they did knee aspirations in people with osteoarthritis and found that 90% of people had a species of mycoplasma. And so I think these things are very present, and they're very present in just symptoms that come and go. I think we all have microbe activation going on from time to time. But if it gets to the point that you have enough microbe activation to fuel microbe or cellular destruction that fuels more microbe reactivation, then it becomes a vicious, self-sustaining cycle. And that's what chronic Lyme is. But it's also, I think, what really every other chronic illness, so we start seeing connections between all these microbes, Borrelia and others, to Parkinson's, to MS, to all of these different illnesses. I think it's a very similar thing. So when you look at that on that curve, that boiling point is, past the point that you're symptomatic enough to see the doctor, but generally before you get a diagnosis, often before that you're going to have enough microbe activity to have a positive test. So that makes seeing a conventional doctor really frustrating. So if you want to win this battle, you have to do long-term suppression. Not just the Lyme bacteria, but everything else that's been reactivated, known and unknown, in your tissues. But you have to do that without adding cellular stress. And I think that's really important. The problem with doing that with antibiotics is the antibiotics are toxic to your cells. They disrupt your gut microbiome. They generate antibiotic-resistant pathogens that cause a long range of problems. And it's also true with any other therapies that add cellular toxicity. You may get better for a while because you've reduced the microbe load, but you haven't gotten to the root causes of the cellular stress that are the real root of the problem. So a lot of people don't get well. So again, antibiotics disrupt flora, antibiotic-resistant pathogens. They can disrupt the mucus barrier in the colon, causing long-term issues. And so when you look at antibiotics, they're great for fast-growing bacteria like pneumococcal pneumonia that's turning over very fast. All of these other things, it's like pneumococcal pneumonia turns over every 20 minutes. Borrelia turns over in its active phase every 12 to 24 hours. It's very slow-growing. Antibiotics aren't a good fit. So we have this thing of this inherent toxicity of the therapies actually can keep us from getting well, and we can't use them long term, so we're not really solving the problem. So you have to keep the pressure on. The best way to do that is with herbal therapy, because herbs are simultaneously reducing microbe load and restoring integrity of cells. All herbs have broad spectrum antimicrobial properties. Some herbs are better as Teresa said, some herbs are better for some things than others. It really depends on the microbe stress of the plant its native environment of what it's having to deal with. But viruses, protozoa, yeast, bacteria, but also parasites in the gut. Neutralize inflammation, which is basically cellular stress. Protects cells, optimizes immune function by reducing the immune system's load, right? So all those cytokines, it normalizes cytokines by reducing the microbe load and restoring the cellular integrity of our immune system. It's really important. Everybody talks about how the herbs do the cytokines, but they don't talk about, what is the herb doing? Well, it's reducing cellular stress and reducing the microbe load, and that is what fixes it. Unlike antibiotics, herbs are selective for pathogens, don't disrupt normal flora, don't generate antibiotic-resistant pathogens. There are a lot of great herbs out there. I think I'm at the end of my time. But so this is a list that I've been using in my practice for a long time. Chinese skullcap is on the list. It's one of my favorites, as is cat's claw. These herbs were recently studied by a series of studies that first came out of Johns Hopkins University, showing that these herbs were as effective as antibiotics against Borrelia, Babesia, Bartonella, and a range of other microbes. So you really have a whole broad spectrum. But they do that without causing cellular stress. Of course, you have to do your part. Clean diet, clean environment for you and your kids, stress management, plenty of good sleep, impact physical activity, or if you can't exercise, sauna, really important, move blood. And so when you alleviate the stress, people get better. So that's the conclusion.
Thank you so much. And if we could have Teresa come join us for the question and answer panel.
As you guys have questions, please feel free to come up to the mic. It's a large room, not great acoustics, so we'll all be able to hear you if you talk to the mic.
I also do want to mention too, I know that a lot of us are getting lots of information. If you go to your program, there is a QR code on the first page that you have access to all the presenters' PowerPoints. So that I'm sure will be so helpful for you guys that you don't have to feel it.
Thank you so much for the presentation. It was amazing. I think I heard at the whatever that was, hour and a half more than I have heard in the last 10 years. I have a question. So I have chronic Lyme, and I got it when I was when my first daughter was on the spectrum, was 3 months old, so I was breastfeeding her, and I knew that I had Lyme, but at the time the doctors put me on antibiotics, and they said that it's fine, you can breastfeed, it's not going to transition to your daughter. So then when then I was pregnant with my second daughter, having chronic Lyme already. I tested the girls, but all those tests are not accurate. So I tested for babies. I have Lyme and Babesia. They tested negative. But do you think that I should put both of them on the treatment? I mean, do something with them, give them some herbs. Like, would you think that?
So, first of all, we're not allowed to give treatment advice. I'm just going to say that to keep us all in trouble. So the question, if I
can summarize it is, do you want to treat your child with Rawls or yourself?
Well, definitely myself, I will, but do you think that it would be good for the girls to also take the herbs? Like, would you think that even though the tests are negative, do you think that they probably have, a contract that and it's dormant somewhere in their cells, that's why it's not showing up in the test?
Okay, I understand. Yeah, so the tests are, as we've shown, very poor at picking up diagnostic, and the herbs are very safe. So you certainly can run a course of herbs and see if they're beneficial.
And would you think that the three that you mentioned, the stevia,
The glucometics, because it has the cemento, the NutriBRT, and the Chinese skull cup. The protocol herbs are listed right there on the slide.
Hi, thanks for being here. I have a 13-year-old son who was very neurotypical until about 12, a little over 12.
We're struggling to hear the questions.
Can you hear me now?
Yes.
So I have a 13-year-old son who was very neurotypical until about 12 and had an acute personality change after influenza B. We've since found out he has BARDS, he has mycoplasma, MTHFR, all sorts of things. So he has bouts of very severe psychiatric symptoms and then goes back to baseline. He doesn't have memory of when he does have psychiatric symptoms, so it's been a really strange journey. We have a wonderful doctor, this is our third doctor. He's very collaborative, he was excited about me coming here. He's been here before, but he's currently has him on disulfiram and monocycline. This is the 4th antibiotic he has been on. So I know you can give medical advice, but for someone who's wanting to transition out of the antibiotic route into purely herbal, what does that typically look like?
I think, there are different routes. Teresa, or Nutrimetics, and the protocols that I use are a little bit different, but they do use some common herbs. And I think one of the things with herbs is that you're covering a lot of bases, and it's not just like here's the absolute 4 herbs or 6 herbs that you have to have. There are many, many herbs out there, and I tend to gravitate toward the herbs that have the most evidence and have the lowest potential to actually harm people.
It would just like confirmation of this. Is there ever any reason to test? Or is there a scenario where you would test?
Yeah, I'm still struggling with that question myself. So, had someone who has all the symptoms of chronic Lyme disease, but you have a negative test. The test for Borrelia is negative. And like I said, we're not, I think of an infection as when the microbe first enters the body. I don't even use the word chronic infection anymore. It doesn't really make any sense. They become ill-fitting residents inside our body. So that whole scenario is very, very different. And most of our testing is designed for acute infections. It's really crazy. The testing is designed for acute infections. Most people don't get symptomatic around the time of a tick bite. Most people to be looking for testing have chronic symptoms. Our testing is getting better, but even so, you look at that long list of microbes that I presented, yes, you can have all the symptoms that are essentially chronic Lyme disease, and Borrelia isn't even there. So, that's the problem. And we do testing. It's this whole thing. It really comes from managing acute infections. Is we have to test to find the microbe that's making you sick, so we can target that microbe, eradicate it from your body, and get you well. And chronic Lyme disease, that doesn't really apply. So, in our protocols, I just assume that Bartonella, Borrelia, and Babesia, and a lot of other things are there, And the herbs give you the luxury of being able to use multiple herbs to cover all of those bases, which I think is very, very important. That being said, from an academic point of view, the more we know, the better. And people just living in our world need some justification. So getting a test, if you get a positive test, that means you can go to the doctor and say, I have Lyme disease, or I have Bartonella. So sometimes it gets your foot in the door, but most of those things are designed for acute aggressive therapy like antibiotic therapy, which can be specific for specific microbes. When you are using herbs, you don't need that specificity. You don't need precision medicine because the herbs are doing so many things. We're not talking about a single agent. We're talking about the plant's entire defense and regulatory system that we are pulling into our system to promote cellular health, to promote healing. So it's just a whole different way of thinking about things.
Yeah, I'd like to comment. In my practice, I do it both ways. I found that I did a lot more testing in the beginning, which helped me to have the knowledge base to help more people that couldn't afford the testing later, because you can see patterns. I will say that there is a lab called Medical Diagnostics Laboratory out of New Jersey that is covered by insurance. And they do IgGs and IgMs, which is not the best, but if it's covered by insurance with your codes for your symptoms, you can get a Bartonella, Henselae, Babesia microti, Mycoplasma, Chlamydia pneumoniae, Epstein-Barr, HHV6, CMV, 3 Borrelia tests, and it's covered. So I love that as a screening tool, because if I see something positive, it can steer things a little better. And then I love T-cell testing when I'm confused, when I've treated for a while and someone hasn't gotten better. That happens every now and then, and I'm like, what's left? I've treated everything, and sometimes I just have to go harder after one particular microbe. But honestly, there's like millions of microbes, and we can't test for more than like 20 anyway, so what's the point? Use the broad spectrum herbs and you're covered, and that works 99% of the time.
Yeah, I think this applies to broader testing. We're really a very testing-heavy society because our whole system is built on testing. So many providers have substituted testing in for actually talking to patients. Doctors don't talk to patients anymore. In my practice, I found the more I talk to the person, the fewer labs that I needed. And the body is telling you so much. Like I said, your cells are talking to you. And if those symptoms have meaning, they're telling you what's going on. It's really important to pay attention. So when you look at the testing that's done out there, both in conventional and functional medicine, about 75% of it, no actions are ever taken on it. And I always used to tell